everyone. We are here live at the 20th anniversary of Nigerian Nurses Association at the Marriott Hotel in Tarrytown. I'm Patience Curry with Mobile Productions and with Nnausa. Standing here with me, Dr. Grace Nnausa, the founder of this great association.
I just want to thank God for this beautiful day. August 20th, we're celebrating our 20 years anniversary.
With me here is Dr. Id Udosin, the current president of the Nigerian Nurses Association.
Right now we are collaborating with the MSK colorectal cancer, and we're also collaborating with the health and hospital for research in the community.
Hi, Dr. Godgiver Coley. Nice to see you here today on this 20th anniversary of Nnausa. Tell me, I understand that you deal a lot with the medical missions in Nigeria. Just tell us a little bit about what Nnausa is doing in Nigeria with medical mission.
I thank Almighty God that Nnausa members have hearts of compassion, empathy, and love for humanity. And as a result, we have been going to medical mission. As Gandhi has said, you need to be the change you wish to see in the world. And as a result, we go there trying to take care of men, women, health education. Professionally, I'm a midwife, so I usually deal with the women and children. But Nnausa members have been going to Nigeria for a very long time, providing health care.
20 years ago, when I did community assessment about Nigerians in New York, I realized that many were not taking care of their health and they were dying from preventable diseases. As a nurse, knowing that the importance of health education, I now put together Nigerian nurses. I put a call out to nurses to join me to reach out to our community. Today, 20 years later, we are over 100, and this is so beautiful. You know, we reach out to our community. We are in the churches, we are in the community association, and we are also in Nigeria.
Standing here with the keynote speaker for the day, Dr. Natalia Cienes. Thank you so much for joining us today. We appreciate you being here today. So tell us, your relationship with Nnausa and the future collaborations you have with Nnausa.
Well, it's such a great collaboration. We have so many nurses that are part of Nnausa at New York City Health and Hospitals. This is the beginning of a new era, starting the ambassadorship program today. Awesome. We have 20 nurses across our entire system, the largest municipal public health system in the United States, and we're so proud of this. We plan on doing research, looking at health disparities and tackling health inequities. So excited about this opportunity to really collaborate. It's time for us to do more in our communities.
We are really focusing on encouraging all our members to have their high education, to move where they are. Doctoral is not the end. Certification is encouraged, so everyone is encouraged to be not just a registered nurse, but a registered nurse with so many letters at the end of that name. Nnausa is 20 years and we are so happy, but we need a place to call Nnausa House, and that can be used for our community services, our health clinic, and also outreach to the community and also to help the community more.
I'm standing here with the planning committee, Mr. Benjamin Okweseyi. Mr. Benjamin was the past president also of this association. Why we are here today and what we're doing today.
The planning started after the executive and the general house agreed to have a 20 years anniversary, which is a milestone of achievement. Once that decision was reached, a committee was selected by the House, and I was fortunate to be selected as the chair. We went and picked people from all the 4 walls of Nigeria that belongs to the association, and from right there we started having meetings. We wanted to look at the journal. What should be on the journal? The journal should contain every activities that Nnausa has done in the last 20 years.
standing here with the Consul General of the Nigerian House. Welcome, sir. Thank you for joining us today.
We've had a good relationship and we have been working together, and the flagship program has been the quarterly outreach program in which the nurses come over to the Nigerian House to render medical services to Nigerians who come for consular services. We have indeed been blessed tremendously from that outreach, and we look forward to having more and more and better planned initiatives that would help us in the future.
So welcome, Ma. You're looking so sweet and so gorgeous.
I have been in this association for about 15, 16 years now. And my first experience that excited me so much, I think that was the second trip to Nigeria, was when we went for a medical mission to Edo State.
And I'm standing here with the NANA president, all the way from Pennsylvania, Dr. Judith Aworonebe.
I am so glad to be here today as the national president. This is amazing that New York is celebrating their 20th anniversary. It is a surprising thing because when we think about 20th anniversary, some people think in 20 months, no, this is 20 years. So we are happy as Nigerian Nurses Association in North America. We are glad to be celebrating with Nnausa. And we thank God for the Nigerian house they want to build.
Yes.
May God grant them peace, unity, love, and provide the money to build it, because it's going to happen, because they are going to change so many lives.
If you look towards the high table, you will see some very distinguished, honorable, distinct personnel, professionals. These are people of character, people of noble causes, and people who have distinguished themselves in life. And they are here to support this noble cause with their wallet and their purses.
You know, I've been working with NANA, the national body, for a while. I've met with different organizations within NANA, but I must be honest, nobody does it like Nnausa.
Yeah.
Nobody does it like Nnausa.
Thank you.
You know, it's been a wonderful experience. The leadership is amazing. Everyone has been fantastic during this event. Their founder is such a humble, down-to-earth person, Dr. Grace, and to everybody at Nnausa has been wonderful. My advice is keep doing what you're doing. You're doing an excellent job. You're doing great in our community. You're doing great in Nigeria. You're doing great in America. Keep doing what you're doing. Let's build that building. Let's have a home for Nnausa, and let's come back next year to celebrate more.
Like to see the association in the next 5 to 10 years?
Oh, it's for us to grow, especially with the new millennium, the new Nigerian young nurses to be part of this organization, and also to help improve the healthcare system in Nigeria.
In the next 5 years, this association is going more global. Already we are global. So in the next 5 years, we're going to have our house, we're going to have clinics, we're going to have increase in nurses, advanced practice, we're going to have increase in certification. And we're going to have more Nigerian nurses in politics, more Nigerian nurses in policy-making position, and more Nigerian nurses in leadership in all over walks of life.
At this time, we're going to ask Mrs. Tawa Adeniji to talk to us about the strategic plans of Nnausa.
And we want to collaborate with other associations like Eco Club, National Association of Nigeria, Take Me to My Village. We want to adopt a healthcare center where we can renovate old primary health center, where we can give services to the people.
What advice can you give to the Nnausa members? What advice can you give to us?
The advice I would give the Nnausas is the unity. When you work together, things move peacefully. Without peace, you can go nowhere. So we are praying that these 20 years, more people will join to build this Nnausa house, so they will bring more peace, unity, and love among each other.
So what should we expect, today, this 20th anniversary? What should we expect today?
One is to celebrate the nurses, making a difference in the community. Two is to fundraise. Because now that we go to the Nigerians, taking health information wherever Nigerians are gathered, we also want to have a place of our own where these people can come, so they don't have to wait until we go to them. Monday through Friday, Monday through Sunday, our nurses can volunteer and carry out preventive medicine. And then they'll be able to provide more health education, more screening, more services when we have our health center.